Hi, my name is Nicole Neal, and today I'm going to be going through a PowerPoint on acute glomerulonephritis. Glomerulonephritis is an important cause of renal impairment, accounting for about 10 to 15% of cases of end-stage renal failure in the United States, following only diabetes and hypertension in importance. Glomerulonephritis is inflammation of the tiny filters in a patient's kidneys, and those are known as glomeruli. Glomeruli remove excess fluid, electrolytes, and waste from the bloodstream and pass those into the urine. Glomerulonephritis can come on suddenly, and that's known as acute, or gradually, which is known as chronic. Acute glomerulonephritis often presents with a nephritic syndrome, such as hematuria, proteinuria, or impaired renal function, together with hypertension, fluid overload, and edema. Severe or prolonged inflammation associated with glomerulonephritis can actually damage one's kidneys, so treatment depends on the type of glomerulonephritis the patient has. The pathology of this disease process involves inflammation and cellular proliferation with secondary renal impairment over the course of days to weeks. So that definition excludes glomerular diseases without cell proliferation or nephritic presentation. But in primary glomerulonephritis, the disease is almost entirely restricted to the kidneys. While in secondary glomerulonephritis, it occurs in association with more diffuse inflammation. Prompt diagnosis of glomerulonephritis, as touched in the last slide, is vital as patients with even mildly impaired renal function, hypertension, and urinary abnormalities may rapidly lose kidney function if this is not treated urgently. The inflammation is thought to be autoimmune mediated and involve both cellular and humoral immune systems. In each case, a unique initiating stimuli occurs by one of at least 4 different mechanisms and is followed by a common pathway of inflammatory and subsequently fibrotic events. But whatever the initial events, common inflammatory pathways follow with activation of the coagulation and complement cascades and production of pro-inflammatory cytokines. Activation of complement components leads to chemotaxis of inflammatory cells and cell lysis. The coagulation cascade leads to fibrin deposition. Whatever the initial events, common inflammatory pathways follow with activation of the coagulation and complement cascades and production of pro-inflammatory cytokines. Activation of complement components leads to chemotaxis of inflammatory cells and cell lysis. The coagulation cascade leads to fibrin deposition. Cytokine release leads to activation of the glomerular cells themselves, and a change in the cell phenotype results in cell proliferation and overproduction. Failure of apoptosis, which is the normal mechanism used to resolve inflammation, is important in this as well. Finally, in the chronic phase of damage, hemodynamic alterations lead to hyperfiltration, hypertension, with subsequent development of glomerular sclerosis and chronic interstitial damage. The clinical manifestations of glomerulonephritis depends on whether the patient has the acute or chronic form of the disease process. The first indication that something is wrong for the nurse or the advanced practice nurse might come from the patient's symptoms or from the results of a routine urinalysis. The signs and symptoms of glomerulonephritis include pink or a sort of cola-colored urine from red blood cells in a patient's urine. This is known as hematuria. And then also proteinuria, which will display as foamy urine due to the excessive protein, hypertension, which is high blood pressure, and then fluid retention. The patient will present with edema with swelling that's evident in the patient's face, hands, feet, and abdomen. If the advanced practice nurse suspects that a patient has glomerulonephritis, that advanced practice nurse will order tests to examine the contents of the patient's urine, such as urinalysis or a urine microscopy, to see if there is a high concentration of protein or inflammatory cells. Also, elevated levels of red and white blood cells in the urine are very typical of this disease process, so this is a significant clue to making the diagnosis. In addition to the urine tests, the nurse may order certain blood tests to look for inflammatory markers that indicate that the patient has glomerulonephritis. Additionally, a kidney biopsy is typically performed to confirm the diagnosis. For severe acute glomerulonephritis, it is important to treat it aggressively with steroids, biologic drugs, or chemotherapy agents. Which medication is best for each patient depends on a number of different factors, including how severe the disease is and what caused it, as previously mentioned. When an infection triggers glomerulonephritis, the primary therapy focuses on the treatment of the infection rather than with drugs that suppress the immune system. For a mild case of glomerulonephritis, the advanced practice nurse may only prescribe blood pressure medication to reduce the pressure and damage of the arteries in the kidneys and glomerulus, and then closely monitor the disease process. Considering that prompt treatment is necessary to increase patient outcomes, the advanced practice nurse will need to closely monitor, diagnose, and treat the patient if acute glomerulonephritis is even suspected. In addition, providing emotional support is important, considering this time will put the patient in a high anxiety state, which has been shown to decrease the effectiveness of treatment and patient outcomes. This is a time where non-pharmacological forms of anxiety treatment and therapy could be utilized, as well as pharmacological forms. As always, offering prayer in times of severe stress and worry, as well as caring for patients using the Christian qualities of kindness, empathy, and dedication, is the unique power that the Christian nurse has to use in his or her nursing practice that distinguishes them from non-Christian nurses. So we've reached the references slide, and this is the end of my presentation. I hope that you guys enjoyed it, and I look forward to listening to your presentations. See you next week.